Hello, my name is David Cogley. I'm an orthopaedic surgeon here at the Hermitage Medical Clinic. Welcome to our joint replacement school. We're looking forward to welcoming you to the Hermitage Hospital, and hopefully this will transform your life for you in the next few weeks. Hip replacement surgery, bar none, is probably the most successful operation that we've devised over the last 100 years. I would say that 96-97% of my patients are universally happy with their hip replacement. That unfortunately leaves a small percentage of patients who are not that happy, and that is down to a number of potential complications or issues that occur when we're dealing with a very complex biological system. These really are divided into 3 or 4 areas. First of all, even though we do hip replacement surgery very frequently, and I do about 250 hip replacement operations in a year, and the hospital here does almost 1,000 hip replacement operations in the year, it is still major surgery, and that means that there is a chance of significant blood loss that may put pressure on your heart or on your brain and cause a heart attack or a stroke. We do our best to avoid this, and you will go to a pre-assessment clinic 2 or 3 weeks before the surgery to make sure that you're fit for the surgery. However, nonetheless, it is still major surgery and there are risks involved in that. The second area is blood clots in your leg, and that is not uncommon after hip replacement surgery if there is no treatment. About 7 out of 10 people will develop a blood clot in their legs. We do lots of things here at the Hermitage Clinic to try and prevent that from happening. We will get you up as quickly as possible after the surgery, oftentimes on the same day. You will have foot pumps on your feet to simulate walking and return the blood back up through your legs from immediately after the surgery and recovery. You will be on blood thinning injections while you're in the hospital, and you will go home on blood thinners also. This will reduce the risk to around about 3 to 5%. And of those patients who might develop a clot, the worry for us is that the clot may travel from your leg to your lungs. And that happens maybe less than 1% of the time. The other issues tend to be more specific to the hip replacement. What we put in is metal and plastic, and hopefully we'll have one in the room that we can pass around to you and you can see what it is. But as it's metal and plastic, it does not have a blood supply, and therefore the body finds it very difficult to deliver the foot soldiers to fight any infection if bugs happen to get onto that implant. That can happen either during the surgery, and we do lots of things to try and prevent that from happening, including operating in spacesuits in a clean air environment, changing our gloves before we implant the implants, and giving you antibiotics. You have bugs in your skin, and we have to cut through your skin to get to the hip joint. So in a small percentage of patients, it's possible to get an infection into the joint. That occurs in our hands maybe less than 0.5% of the time, but it can be serious and involve revision surgery, which means removal of the implant to get rid of the infection if that happens. The other time when bugs can get onto the implant is if they get into your bloodstream, and that can happen if you get blood poisoning or septicemia, or more commonly if you have another operation. The commonest operation that can cause bugs to get into your bloodstream is dental work, such as dental extractions or root canal work. Fillings and cleaning is not as big an issue. Therefore, if you need to have any major dental work performed, it's much better to have that done before the surgery than afterward. The other issues generic to hip replacement are dislocation and leg length inequality. I mention those together because they're intertwined to a large extent. Our dislocation rate is less than 1% here, but half of those patients who do dislocate may require further surgery. The hip replacement comes in 2 parts, and the 2 parts are held together by the muscles around the hip joint, and they have to have a certain amount of tension on them to hold the hip in position. It's a bit like guy ropes holding a maypole in position. If the guy ropes are tight, it'll stay in position. If they're loose, it tends to wobble around. We have a number of strategies to try and exert tension on the muscles to keep the hip in position, but if we run out of all of those options, the final option that we have is to lengthen your leg. It's possible to address this concern afterwards with a small heel raise in your opposite shoe, and you can walk around with a heel raise in your shoe, whereas you cannot walk around with your hip coming in and out of position. So we will sacrifice limb length equality, we will endeavour to get it correct, but we will sacrifice limb length equality for stability in the hip joint. The other issues are rarer but can have a significant effect. We have to place the hip replacement into the bone in the bone socket for the acetabular component, and into the marrow cavity of the femur for the femoral component. And when we're doing that, it's possible for the bone to crack. If that happens, you will not be able to take full weight on your leg until the bone has healed. And once the bone has healed, then the hip replacement will behave as if the fracture had not occurred. Very occasionally, if you were to fall on the hip afterwards, or if there's a minute crack that isn't noticed at the time of surgery, that crack can propagate as you weight bear on it, and that may require revision surgery of the implant. The final potential complication is very rare, and that involves the nerves and blood vessels around the hip joint. We have to move the two major nerves away from the hip joint as we do the procedure, because they lie just in front of and just behind the hip joint. Occasionally these nerves don't like being moved out of the way, particularly if there is a tether on those nerves, such as previous surgery around the hip, previous surgery around the spine, or in patients whose nerves are already sensitized by perhaps diabetes. The risk of this happening is about 1 in 600 or 700 hip replacements, but it can leave you with a permanent defect and permanent difficulty in the muscles that nerve supplies. We would hope that this would not happen to you. It is important, although I've enumerated a lot of complications, that you think about the risks and benefits of the surgery. If we do not do the hip replacement surgery, it's likely that the hip arthritis will continue to progress, and the symptoms that you have currently will gradually disimprove, and over a number of years will leave you with permanent pain and a permanent inability to walk. So hip replacement surgery, although it comes with a small amount of risk, is a very successful operation. From a surgeon's point of view and from your point of view, you will want to know, how long will I be in hospital after this procedure, and what happens when I go home from hospital? Most people are in hospital after hip replacement surgery now between 1 and 3 days. In some cases, some patients have gone home on the same day of surgery. This is because we are able to manage the pain very well, and we have what we call a criteria-based discharge. So you go home when you're able to go home. Our criteria are that you have to be able to walk for 50 meters on your 2 sticks, you have to be able to go up and down steps and stairs, and you have to be able to independently get in and out of the toilet and shower from your bed on your sticks. This means that when you go home, you should be able to pot around at home and make yourself a cup of tea or a sandwich. When you go home, it's important to realize that you've had major surgery. In terms of activity, we would like you to be up and about and walking, but walking small amounts and frequently. And when you're resting, we would like you to rest. And it is important to rest as it is to do your exercises and to do your walking. I would like to welcome you to the Hermitage Clinic and wish you well with your upcoming surgery. If you have any further questions, please don't hesitate to ask us. And as there are many people in the room, we expect that we will probably have many questions, and the more people that ask questions, the better.